Can you guys hear me? Okay. Hi, my name is Amanda, and today I'm going to be talking to you about Botox. So, how many of you would choose to inject your body with a bacterium? Now, what if I told you that bacterium was one of the most poisonous substances known to science? So, according to the American Board of Plastic Surgery, last year alone, 4.4 million people received Botox injections, making it the number one cosmetic procedure in 2020. Now, I personally have always had interest in the phenomenon of Botox, and doing my research made me even more interested in it. So, for the next few minutes, I am going to be going over with you guys what Botox is, how it works, the uses of it medically and cosmetically, and the side effects. So, what is Botox? So, botulinum toxin, better known as its prescription name Botox, is an injectable neurotoxin. It's made from the bacterium Clostridium botulinum, known as C. botulinum. It's naturally occurring, so it occurs in soil, rivers, dust, sea sediment. And according to the National Health Service in the UK, it is not harmful on its own, but if it's deprived of oxygen, then it becomes harmful. So if it's in soil, if it's in the human body, it will not have oxygen and then it becomes poisonous. So that's where we get the disease botulism from. So in order to make Botox, the bacterium is purified down to the neurotoxin, and then that neurotoxin is combined with other proteins, and that makes Botox. So how does it work? So according to the American Academy of Ophthalmology, Botox blocks the nerve signals that make the muscles contract. So it essentially paralyzes them and then blocks the release of acetylcholine, which is the main neurotransmitter in Botox. So when it's injected, it will block the acetylcholine from getting to the nerves, and it causes the muscles not to contract. So it lasts about 3 to 6 months. And then after that time period, the muscles will start to contract normally again. So it has a lot of different uses, both medically and cosmetically, but I will start by talking about the one that we know the most, which is fixing wrinkles. So what Botox does when it's injected into the face is it smooths down your look. So if you have any crow's feet, which are these lines right by your eyes, or 11 lines right in the middle of your forehead here, and also forehead lines here, smile lines, frown lines, anything like that, that Botox will come in and it will cause those muscles to not contract. Therefore, the skin on your face won't wrinkle. So according to an article by Allison Chu of the Washington Post, she says that there is now a new phenomenon of preventative Botox in the younger generations. So the idea of preventative Botox is that you'll get Botox injections much earlier in life rather than in your 40s or early 30s. People are starting to do them in their mid 20s in order to prevent the wrinkles from starting. So that is one of the uses, but also it is used to stop hyperhidrosis, which is the condition of excess sweating. So in a study by the Department of Dermatology at Bangalore Medical College and Research Institution, they found an 80% reduction in sweat after using Botox in their underarms. So they had done a study, and their patients after 3 months came back and there was an 80% reduction in sweat. So along with that, the FDA also approved Botox injections for migraines. So they have to be chronic migraines. So a chronic migraine means that you have a migraine for 15 or more days. It doesn't have to be consecutively, but 15 or more days of the month you have a migraine. So that sounds terrible to me. But the American Migraine Foundation says that the Botox is injected into the pain fibers, and it will block the release of the chemicals in pain transmission. So when the Botox is injected into the head, it blocks those chemicals from being released. Therefore, the migraines will go away. So Dr. Andrew Blumfield, who is the director of the Headache Center of Southern California, said that the more frequent the headaches, the better the patient will do with the Botox. So of course, with any medical or cosmetic procedure, you're going to have side effects, right? So the American Society of Plastic Surgeons says that some side effects of Botox can be injection pain and bruising, headaches, nausea, flu-like symptoms, and sometimes temporary facial muscle weakening. So obviously, some people won't get these symptoms at all. Other people may get these side effects. That's just based on person to person. So now that you know what Botox is, how it works, the different uses and side effects, I'm inclined to go back to my original question. Would you inject your body with Botox? Thank you guys so much for listening, and I hope you liked learning about Botox. Thank you.